what is the meaning of continuum of care. Now, we will give a general description of what is continuum of care, how to do the screening and assessment, what are the detoxification options, all those things we will be discussing in this particular module. So let's see. 4 parts of continuum of care. There are 4 parts of continuum of care. The first is pre-treatment, then the primary treatment, case management, and continuing care. As I said, continuing care means follow-up. Continuum of care means the whole ranges of services, which include pre-treatment, primary treatment, case management. We started discussing it in the previous module. Here we will be discussing it in detail. And as you know, we have a whole curriculum on case management in the advanced universal treatment curriculum. So what is this pre-treatment or pre-treatment components? Outreach, screening and brief intervention, assessment and treatment planning, detoxification. Will someone speak on outreach? What is outreach? Can you please tell us something about outreach?
Outreach means get into the affected patients, in this case SUT patients.
Okay. So outreach, the very meaning itself is that reaching to the unreachable people, that we are going into the field and reach our services to the community. So awareness programs, all those education building programs can be part of the outreach. Screening, will you be able to say name of one of the screening tools for alcohol? Just one screening tool.
Alcohol
Can someone say? Pardon?
Alcohol breath test.
Audit.
Oh, okay.
Test.
That is not actually. That is doing as part of the follow-up checkups. Alcohol test. I'm asking a screening tool for alcohol dependence or substance use disorders. Okay, screening tool means a tool used to check the existence of the problem. So a screening tool is used just to know whether a problem exists or not. Example, audit. Audit is a questionnaire consisting of 10 questions. Very simple screening test. Another one is assist, which do a screening of tobacco and all other drugs. Especially, this can be done for both adults and youths. For youth, we call it assist Y. Anyhow, you will be introduced into all the screening tools and assessment tools in curriculum 5, that is UTC 5. I'm not going to discuss this in detail. And after we do the screening, when we do the screening, we know whether there is a problem exists or not. And based on the screening test, intervention is given. If the dependent level is very low, we just give education. If it is a little higher, we give brief intervention. If it is a chronic level, then treatment and other psychosocial therapy is given. So that is why we do the screening. Assessment. Assessment is a test, is a tool used to assess the intensity of the problem. Once you assess the existence of the problem, we are checking how much the problem, what is the intensity of the problem, which are the areas affected, and how should we plan the treatment. Based on the assessment, an example is ASI, Addiction Severity Index. When after we do the ASI, Addiction Severity Index, we do the treatment planning. As you know, treatment planning is jointly done by the client and the counselor. Unlike there is a belief, some people believe that treatment planning is done by the counselor. That's not right. It is jointly done. Then the detoxification. Detoxification is part of it, the pre-components. For example, you can do detoxification at home. You can do it at the treatment facility. It can be based on hospital-based. See, in some home-based treatment, detoxification is done at the home. Like in Afghanistan, when I was in charge of the treatment centers in Afghanistan, we used to have home-based treatment. So there we can also do the detoxification. But nowadays, it is said detoxification should be done in the hospital because it is more safer and more effective. Now, outreach. I already told you what is outreach. I'm not going to discuss all these things. Can you please understand? Outreach is that we conduct programs in the community. Extension services. This is organized to identify or screen whether there is a problem exist or not. Outreach goals. How do we conduct, or what are the goals of outreach? First, we have to establish a contact. That means we have to go to a community or an area, establish a relationship with the people there. There are various methods done. You can contact the community leaders, the organization leaders, the treatment professionals, all these things. Then you build up the trust. Then relationship is developed. A kind of reciprocal relationship is built up. Then try to link it with the healthcare agencies. Once the healthcare agencies linkage is established, we can conduct screening and then brief intervention for the people who are being affected by alcohol and other drugs. So it's a way of establishing a rapport and then providing brief intervention in the area. That is outreach. Like ODIC, drop-in centers are all coming under that. Why outreach? Why should we have outreach centers? Outreach centers are needed because sometimes coming to the center for the people, for the addicted, for the people with alcohol or drug problem, it is intimidating. There are certain issues. If they come to the center, there is a social stigma. So if you provide the services in the outreach, it is easily accessible for them. Sometimes the treatment services is difficult to get. The treatment facilities may be far away in the town, in the city, and people who are living in a remote villages, it may be difficult for them to obtain. So in that circumstances, it would be much easier for them to assess the treatment. And therefore, we provide outreach centers. And it is too rigid or judgmental in their approach. Sometimes treatment centers are very rigid and their rules are very strict. But whereas if you conduct outreach programs, people can easily access it. And then needs may be irrelevant and it may be too costly. The treatment facilities in the town or in other places may be very costly, not easily accessible. At that point of time or in that context, outreach centers are much easier, cheaper, easily accessible, not intimidating. Methods. How do we do these settings, outreach centers? We can provide education through community organization or other agencies. We can conduct it in homeless shelters or HIV clinics or community centers or in drop-in centers. See, like as I said, ODICs. We can also conduct education screening in schools, social centers, and clinics. Social centers means those centers run by different agencies, maybe religious people, maybe NGOs, maybe certain trusts, maybe political parties. All these centers we can make use of providing education and screening and intervention. The effects or the efforts. How do we do it? What are the efforts we need to take to establish outreach centers? We can take the services of paraprofessionals. We can take the services of peer educators. Also, the medical staff for brief intervention and referral work. So basically, three type of people are being fully involved or engaged, like paraprofessionals, like laboratory technicians, the paramedical professionals, all of them can be involved, any type of professionals, or we can also use the other professionals like dance club. All these professionals can be used. Then we can take the services of peer educators. I understand I believe that you understand what is who is a peer educator. Peer educator is a recovering person. Normally, in an addiction field, we can use the services of peer educators or substance users or HIV, people who are having HIV or who are having contact in or working as peer educators in the field of HIV prevention can also be their services also can be utilized in our efforts to reach outreach services. And of course, the medical staff. Screening. I already said what is screening. Screening is just to check the existence of a problem, whereas assessment is to understand the depth of the problem. So screening versus assessment. Why there should be screening as well as assessment? Screening, as I said, it is just to know the existence of the problem. Assessment tries to understand the possible nature of the problem, the level of intervention needed, the intensity of the problem, how far the problem is being, how far it is being affected, what should be done, how we should plan the treatment. All those ideas can be derived from the assessment. Whereas screening only gives us a direction or tells us whether the problem exists or not. So that's the difference between screening and assessment. Validity of a screening instrument. So screening, some years back, we did not have any much screening tools because treatment for addiction or substance use disorders was not considered as something evidence-based by many of us. I still remember when I started working as a counselor, many doctors did not believe it as a brain disorder, even though WHO and other agencies had recognized it as a brain disorder. Many medical practitioners did not accept it. So this assessment or a screening was not done properly. So here what we discuss is screening should be validated. In other words, screening tools must be scientific, evidence-based. It has to be validated by international agencies like WHO, UNODC, whatever agency is responsible for that. So internationally validated instruments, as I already said, audit. Audit is a screening tool used for identifying alcohol use problems. It's a 10 items questionnaire, very simple to understand and administer and calculate the score. Another tool is assist. Assist will give about smoking, alcohol, etc. Whereas audit is only for alcohol. Assist is used for adult, and assist Y, a separately prepared one for youth or adolescents. That's also a very simple one. We can use it. There are many other instruments, many other tools. I would call it tools, screening tools and assessment tools like MAST, CAGE, CRAFT, etc. All these tools, you can have it in your participant manual, resource page 6.1. Please do have a look at it. Just check it. What are the tools available? What are the screening and assessment tools? Internationally validated tools available. Please check it. Now this is after screening what you do. As I said, why do we do screening? We do screening to know whether a problem exists. So once we do the screening using the internationally validated tools like audit or assist or a craft or a cage or MAST, whatever it may be, and assessment tools like ASI, we understand after the assessment, we identify this is the problem. And if we know that there is no risk or low risk, no intervention is given, only education, only awareness building education is given. We talk to the person, we may give some pamphlets to him for reading materials. IEC materials we give, information material. If we assess that the person has a moderate risk of using alcohol or other drugs, brief interventions is given. And if it is severe, we give assessment as well as primary treatment. Brief intervention, what is brief intervention? I already told you. Assessment goals. Assessment goal is to measure the client's what you call the intensity of the problem, how far the problem is affected. Also, assessment will be done in course of the treatment also, just to check how the improvement is done and to understand the strengths of the client. What is the strength of the client? Can you use another word for the strength of the client? We just learned in Varna session. What is that strength of a client? Put it in another word. It is there. Hello?
Strength of the client. I didn't understand the question.
When you say what is this strength means? The strength of the client. What does it mean?
Strength of the client.
Yes. How do we identify the strength of the client? Any idea? The word is there. You see the recovery capital. See, we can put it together. The strength means whether the person is motivated. If the person is motivated, is positive about the treatment, the strength is very strong. I mean, is very positive about it. And that means his recovery capital is very strong. See, in the previous sessions, we learned about recovery capital. What are the three main recovery capital? Can someone say? We just learned in our previous modules. Can someone say what are the types of recovery capital? Hello? Hello? Pardon? The types of recovery capital. Hello? I can't hear you. What are the recovery capitals? Types of recovery capital. Yeah, please tell. Pardon?
Personal, family, and social, community, and culture.
Okay, very good, sir. Very good. You are right, sir. Thank you. I would clap for you because it is a face-to-face training, means we used to clap each other. Let's clap to alive in the session. Personal, familiar, social, cultural, community. So basically, family, recovery community, capital, personal capital, and the community. So every person, when they come to the center, they have certain strengths. What we all call is recovery capital. Personal strength, the support that he gets from his family and the community. So that also need to be identified during the assessment. Why we identify the strength of the person? Because if the strength, that is his recovery capital is good, the recovery is also good. If he gets support from his family, his community, and he himself is strong enough, his strengths are higher enough, I mean strong enough in terms of positivity, in terms of motivation, then the chances of recovery is on a higher level. So recovery is faster because he is positive about recovery, he is motivated, his motivation level is high, his family members are supportive of the treatment. All these factors contribute to the recovery. So that's why we call it the strength or recovery capital. Okay. Assessment task. What are the tasks for assessment? Our responsibility. like engaging the client. It is not easy to engage the client. That means we must have the consent of the client for assessment. Unless the client consent to assessment process, we cannot do assessment. So engage the client is a process. It's a task. And once we engage the client must give us his history, both his personal, family, and drug taking history, and to obtain data from him. Data means all those socio-demographic data as well as the drug using data. All these things are not very easy to do. That is why it is called a assessment task. Okay, now let's see. In the assessment, what are the areas we assess? We assess why the client took into drug, what is the current use, what is the history of the family of substance use, what are the medical complications and conditions. So in the assessment format, we must check all these areas. The reasons for his continued use of drugs, the current use and a treatment, the family history of substance use. In fact, in the assessment process, we take not only the family history of substance use, we also take the psychiatric disorders and other medical complications or medical history. An example I would say, if Mr. A, that is Mr. A coming to your center, when you do the assessment of his medical conditions, we must check whether he had any family history of DM. DM means diabetic mellitus, hypertension, cardiac disorders or diseases, epilepsy, all those physical issues. Actually, epilepsy is part of the psychological problem also. So that comes along with the mental disorders too. So all this history we have to collect as part of the assessment. Only then we will able to make a comprehensive assessment of the client's conditions. After making the assessment, we go to the next step, what is called a treatment planning. So all these, I'm not going to discuss. So many areas are there. I already told all these things. His emotional, his educational background, his vocational background. That means where is he working, how far he has been working, whether he has been attending the work regularly or he was in absentee. His cognitive skills, that means his IQ level, knowledge level, what type of, whether he attempted suicide, whether he has suicide ideation, all these things are part of the assessment. And then also we discuss about legal issues, other support systems, any relapses or lapses or a previous treatment. Also we check the recovery environment, means the living situation, that where he lives. If he lives in an area where alcohol consumption is considered quite normal and it is quite common, then his chances of recovery may be less. So all these assessments should be done, whether he comes from a broken family, whether he comes from a alcohol using family and other members are using alcohol. All these areas we need to assess. How we can make the assessment? We can assessment, conducting interview, clinical interview. What we call is the MSc, that is mental status examination, and other things that we take. Assessment instruments we can use. So clinical means we just ask him verbally. It's like an interview. So in the interview, we can ask about the history, all those things. At the same time, we can also conduct tools, assessment with the tools and instruments, like screening tools and assessment tools. Then collateral sources. Collateral sources means other sources from where we can gather information, like family, friends, employer, referral sources. Here the family, normally family means we all think that father, mother, brothers and sisters, or the siblings. It's not that alone. Family also means non-biological family. The biological family is the father, mother, siblings, and grandpa and all. But what about children who are in the orphanage, or who are in the shelters, who are orphans, who have nobody? We don't know who are their parents, who are their siblings. So what should be their family? Their family must be the non-biological family, that is where they live, the shelter home director, the housekeeping person, the counselor there, even the security there. All these are part of his family. They are not it's a biological family, but we must consider this non-biological family in cases of who are orphan, who are abandoned, who are living in the streets. Of course, friends also the same way. Employer, referral sources. Referral sources refer to from where they are referred. These people might have been referred from the court, juvenile homes, other agencies. So with them also, we must check to understand or assess their drug using habit or drug using problem. Another area where we can do assessment is urine tests. See, nowadays they do urine tests, blood tests. Some people even do testing the hair, nail, etc. For alcohol, we can do the blood tests. We can test how it is in the body, how much is in the blood, how much, what is the content in the body, in the blood. So all these testing, clinical interviewing, collecting information from the family, friends, employer, and referral sources are a must for making proper assessment of the client's issue. Treatment plan. Once we make an assessment as the areas, various aspects of various areas like physical, psychological, mental, emotional, cognition level, medical level. Once you make legal, all these areas we make assessment. And once we make an assessment, the counselor together with the client make individualized treatment plan. Why treatment plan should be individualized? Can anyone say? Hello? 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 Are you all Are you why it has to be? Okay.
I think the treatment plan should be individualized, mostly because of the diversity of our genetic makeup.
Oh, okay. Okay. So because of the diversity of the problem, yeah, because you see, Mr. Arka, your name is pronounced that way, I believe. I am Francis. Yeah, both of us are drinking. Both of us are drinking or taking drugs, and the nature of drug use may be the similar, but our problems may be different. So treatment plan should be fitting to me, and that treatment plan should be fitting to you. So that is why it has to be individualized. Means a treatment plan should be tailored in accordance with the needs of the individual. I hope it is understood. A treatment plan should be tailored in accordance with the needs of each individual. Each individual. See, we cannot have a treatment plan for all the people or all the clients admitted in the treatment facilities. We have to have separate plans. Of course, there are certain plans which are common, like we may do the detoxification together, we may conduct the education sessions, therapies together. But counseling sessions and the treatment plan must be individualized, because the person's needs differs from person to person. That's the reason. Okay, let's go. Treatment plan identifies needs. All those needs that we identify during the assessment, we have to meet this through the treatment plans. Treatment plan should be addressing the needs of the client, which we assessed during the assessment. So that is very important. Effective treatment plan. What are the characteristics of a effective treatment plan? These are the effective treatment plan characteristics. As I said, an effective treatment plan should be individualized. It has to be flexible, realistic, simple, useful, solution focused, clear, and response to changes and progress. Let's go one by one. It has to be individualized in accordance with the need of the individual. It has to be flexible, means you cannot have a very strict plans. Sometimes the plans have to be changed. Realistic. Realistic means based on the recovery strength, based on the needs of the client, it has to be. Very simple means the plan should be very clear and simple. Solution focused means it has to focus on the solution, not on the problem. That's very important. Then it has to be changing according to the progress. Means what? Sometimes the treatment plan may change while the treatment is going on. So that is what we need to understand. These are the characteristics or important things about the effective treatment plan. If it is an effective treatment plan, yeah, you want to speak something, Arka? Hello?
No, sir. No, sir.
Yeah. Okay. Okay. Somebody is speaking there. Could you please switch on your microphone? Because we have almost 109 slides to complete. So this is a walkthrough. Of course, it's not a detailed discussion. That's why I'm going like this. But I will give you time to ask questions. Treatment planning. In the treatment planning, we need to identify three things. What will be the intensity of the treatment? What is the duration? And what is the setting? Whether it is in the hospital or in a home base or in a separate treatment facility. So these are the things that we need to check. That client's needs are met. His co-occurring disorders or medical care is needed to be treated. Detoxification is need to be supervised. And what is detoxification? Detoxification, that is the process of eliminating the toxic, is done just to stop the substances, clear the substances from the body, manage withdrawal syndrome. So basically we do detox in order to eliminate the toxic thing, that is the drug from the body, also to stop the alcohol use or substance use. It's also to help the client manage his withdrawal symptoms. Example, when an alcohol using person wants to undergo treatment, the first thing that I do is, or I should be given, is detox. When I am, why detox is done? Because during this period, I am helped to manage my withdrawal symptoms like tremors, sleeplessness, loss of appetite, etc. So that is why detox is done. And what is withdrawal? You know, there are various withdrawal symptoms depending on the drugs used. If it is alcohol, you can have tremors. If it is opioids, you can have severe pain. Cannabis, normally no withdrawal symptoms. So withdrawal symptom is just opposite of what is it, the effect. So sometimes withdrawal symptoms may continue for a long time. It's all depending on what type of drug used, how long it has been used, the amount of drug used. In very rare cases, we have a prolonged withdrawal symptoms, like what do you call it, protracted withdrawal symptoms. That is, the withdrawal symptoms may last for a longer time. In certain cases, not in all cases, very few cases. So all this has to be managed at the treatment facility.
Yep.
Medications and during the detox. As doctors, you all know that medications can be given for all these withdrawal issues, like benzodiazepines, barbiturates, other sedatives can be given to manage the withdrawal symptoms. I'm not going to talk on that because these are medicines which, as doctors, we all must know. Goals of detoxification. Why should we do detox? Basically, detox is given. We consider the withdrawal symptoms are very difficult to manage, and it can cause severe pain, severe issues to the client. So the clients who are undergoing the withdrawal symptoms should be helped handling their issues without much difficulties, because they are human beings. And also, why we are trying to do the detox, because detox is like a preparation for further ongoing treatment. In other words, without doing detox, we cannot have further treatment. The primary treatment and other treatment cannot be done without, if you don't do the detox, other treatment like psychotherapy, counseling, education, all these things cannot be done. So detox is kind of like a preparation period for the person. Types of detox. Detox can be done as an outpatient. As I said, home-based detox can be done. I told you what happens in Afghanistan. Is there any sorts of home-based detox in your country, in Thailand and Myanmar?
No.
Hello?
No, sir.
No, you don't have any home-based, residential-based detox. Sure?
I'm not a psychiatrist, but I've ever had a home-based detox program. And even if and as you the patient, he has at least to be admitted to a hospital or to a ward.
Okay. So there are no home-based detox or treatment in Thailand. I think you are from Thailand. Am I right, Arthur?
No, I'm from Myanmar.
Myanmar. So what about Thailand? Any Thailand friends? Do you have any home-based residential services for detox without medication? Any sorts of treatment in your country? Hello, my Thai friends, the country I love very much, because I used to come to Thailand very often.
Always in my mind. Thailand here
1%.
ไม่ได้ฟังค่ะ
Okay, you don't have.
I have
You do not have. Okay, you do not have. Am I right? Okay. But Panita, do you have home-based treatment? No.
base treatment ไม่มีนะอะไรนะ
No.
again home base treatment ไม่มี we don't have home again I'm not clear หมายถึงว่า
Okay, clear. From the image I see, many of you are sitting in your office together and listening. So when you start speaking, please make sure that only one of you speak. I can see the name Panida. Am I pronouncing it correctly?
เขาถามว่าปณิดาน่ะคือถูกหรือเปล่า
Panida. Okay. Panida. Okay. I understand that there are no home-based detox in your country. Said in yeah. Okay. Okay. Good. Okay. I understand. When I was in charge of treatment centers in Afghanistan as part of the Colombo Plan treatment, this thing, I understand during 2010 and 11, that time there was home-based treatment in Afghanistan. As of now, I don't know whether they have. So detox can be done as an outpatient. Traditional methods without medication. What we call is social detox. Can you just switch off your microphone? Because there is a disturbance. Panida,
and
please.
Thai side have methadone clinic we have a service without medicine
Okay.
bring methadone take home
Okay, I understand. Okay, good. So we were talking. Okay, please.
ไม่ใช่ปณิดาตอบไม่ให้ยก
Okay, please switch off your microphone. I am really sorry because we are having a virtual training. When you speak as a group, there may be some disturbances. I couldn't hear much. Anyhow, the discussion cannot be going on for a long time. So let me tell you, the detox service is done as an outpatient. It's a home-based or a residential-based can be done. Now, outpatient with medication can be done either in a small centers or a facility. It can also be done as a inpatient services, like medically managed in hospitals and in specifically made treatment facility centers in medical colleges or in general hospitals where there is a addiction treatment facilities there. So all these three ways we can do a detox. So let's go. Actually, detox is not a treatment. It's only a first step toward a recovery process. That means detox is actually a preparation period for recovery. So that means just giving detox alone will not help the recovery. And now this is actually a group exercise. And let me check the time. We have time, we can do it. Otherwise, yes, we don't have time. I'm really sorry. So let us go to the next slide. Case management. Because this module is so big, it takes long time. Case management is something that is very important in a treatment facilities. Case manager can be a counselor, but a case manager need not be a counselor too. A counselor can be a case manager, but a case manager need not be a counselor. Case manager means basically a person who coordinates all the services. What actually happened, in the beginning I told you continuum of care means all ranges of services within the facility as well as coordinated by the facility. So the concept of case management is very, very, very important for addiction treatment, because a case manager who is responsible for coordinating all the services for the good of the client is an important person who does a greater job. So when we do the assessment and screening and assessment, the recovery process go on. It's like a process, and it is an integral part. So the case management means it's a kind of professional coordination of various services like social, medical, mental, and other complex services or needs, legal, housing, economical, occupational, educational, all these services. So that process of coordination, we call it case management. The very purpose of case management is to monitor whether the client gets all the services, the client from each level to the other level, from pre-treatment to the primary treatment to the final treatment procedure, how he goes, and his journey towards this transition is smoother. For that purpose is the case management is done. And case management is done by a single point of contact. That means one particular individual does the case management. He coordinates the whole thing, coordinates all sorts of services that are needed for the client's recovery, like physical, psychological or mental, occupational, legal, educational, social, etc. So why we talk about case management? Because very often the services we discussed just now, the needs of the client, like the social needs, legal needs, housing needs, medical needs, mental health needs, all these are generally scattered, and it is here the case manager coordinates and bring together all these needs from a single point of contact. Case management, how does case management functions? Case management basically the case manager assess the problem. What are the needs? Then a planning is done. Then the linkage and referral. That means linkage and referral means, as I said earlier, in a treatment facilities, there may not be all the facilities that are needed, or that facility may not able to meet all the needs of the client. In such circumstances or in such a situations, the case manager links the services and refer the clients into various service providers so that he gets proper services from service agencies. And monitoring is also very important. Why monitoring is important? Because you refer a case or try to link the services, we must make sure that the client get access to that services. Example, you referred a client to an HIV treatment center, but as a case manager, we are supposed to make sure that the client gets all the services he needed. The client goes there, get the services. So for that purpose, a monitoring and evaluation, keeping an eye on what is happening is very much essential. Then the advocacy. Advocacy, as I discussed in the previous session, you are talking for the client. You are doing support for the client. Actually, I explained all these things in short. Now we don't have time, so let's go to the next levels. I'm just skipping all the slides. I'm very sorry. I just discussed all these in a very brief because we don't have time. You see, the linkages means housing, financial, legal, all this I discussed. Monitoring means making sure that the client get the services and that progress and coordinates the communication. Advocacy means also the issues are talked and you also speak to other people on behalf of the client. That is a kind of support is, for example, monitoring what you do. And one good example for monitoring is, you see, in our country, alcohol using people are considered bad people. Sorry, advocacy means. So in my country, when people consider alcohol using people as bad, I have as a therapist or a case manager, I have the responsibility to advocate for him. Talk to the government policy makers or talk to the community leaders, social leaders, and try to remove this social stigma by influencing the policy makers and the community leaders and clearing their doubts about addiction. So that is a kind of advocacy that I as a case manager can do. You see, which are the areas we can do advocacy? With organizations we can do, healthcare providers we can do, legal system and the family. How do you advocate or do the advocacy in these areas? Means you talk to these people, you try to talk on behalf of the person with the legal system or care providers, even in the family. You see, there are certain families who do not accept the drug using person or alcohol using person. It is where the importance of case management comes. The case manager talks to that family members and clear their doubts, influence their thoughts, and then slowly they accept the drug using person and they become part of the recovery management system. And the task, all those things. Any questions with regard to this case management and the various responsibilities like assessment, advocacy, linkage, referral, etc. Have you ever done any advocacy for the clients? Hello? Hello? I think, are you all sleeping?
Yes.
Should I sing a song?
Yes. Sing a song. Okay, sing a
Yeah.
song. You can sing a
Yeah. But you may not be able to understand. It's nice. It would be nice. You may sing a song. Is there anyone who can sing a song?
You can sing a song for me.
Yeah, but I am not a singer and my language is different. You can sing your own language. Can somebody sing a song in your own language? Hello?
Sing a song.
Yeah.
Are you hungry?
Okay. Who can sing a song? Or tell us something. Tell us something. Anything? Hello? Hello?
Yeah.
Vanita,
Yes.
please sing a song.
Oh, I can sing a song.
Okay. I will sing a song after the session. Okay? I'm not a singer, sorry. Okay, this is just to make you alive. I just want to make sure that all of you are alive. Okay, let's have a small discussion, a large group discussion. Have you ever done any sorts of advocacy in your profession for the clients? Any example? Can one of you say where you did do kind of advocacy for the client with organizations, with health providers, or with the legal system? Anything that you have done? Have you ever done? Anybody among you? Hello? I think we should have something else now. Hello? Nobody is joining for discussion, huh?
I'm not
Yeah,
I'm not a psychiatric side or ward, so I don't have any psychiatric patients, so I don't have any experiences regarding advocating for the SUD patients.
Okay, Arka, you are not a psychiatrist, but as a social worker or as a counselor, we can do advocacy. Example, you see a community. You can go to the community, talk to the people about addiction and the need of treatment. That is also advocacy. Or you can talk to the family members of a substance using person. That's also advocacy. Arkar, did you get me?
Yeah.
Yeah,
I once
yeah.
talked to
We can do.
I once talked to parents of heroin addict, and who happened to be one of my relatives, and
Yes.
and they I encouraged them to keep on asking for help, but they seems that after failing a number of attempts to quit the habit, break the habit, the parents are quite
Yes.
unwilling to do another time.
Yeah. Okay.
So
Yeah. So when the parents are unwilling to be part of the treatment, can you do advocacy for the client?
yeah, I at least told the parents to try it again for another time.
Okay. Okay. Right. So that is also a kind of advocacy you are doing with the family. You see, advocacy can be done with the health providers, with the legal system, with the family or the community. So, Arthur, you have done advocacy actually, but
I hope it was a kind of advocacy. Although I'm not exactly in the role of a counselor or attendant doctor.
Yeah, okay. You don't have to be in the role of a counselor or a social worker or a doctor. You need to be just a policy maker also. Because if you are a policy maker, if you are a politician even, you can do advocacy. You see, you can talk to your leaders about the need of a policy that are helpful for the drug using person in the process of recovery. So all these are part of the advocacy. Here we are talking about advocacy done by the case manager as part of the case management. Okay, now let's go to the next one, counseling. This is we are having another module on counseling, module 4. So in that module we will be talking about individual counseling and family counseling. So this is just to understand, just to know counseling, why counseling is needed. Counseling is actually in Chinese proverb they say counseling is like giving a fishing rod rather than giving a fish. That means if someone comes to you asking for a fish, you give him a fishing rod or you teach him fishing. So why it is done? Because counseling in addiction is done just to help the client handle his emotions, his thinking, his behavior. It can be done at the individual level as the group level. Individual level means you can have separate individual counseling. Each client can be given separate counselings. And counseling, that process will go on, of course, to handle issues. It can be also done at the group level as a group. That's why we call it group counseling. The therapy sessions and all this can be done. Both are helpful. Both individual and group counseling are helpful in the process of recovery. Why counseling in SUD treatment? Because counseling helps a client stop his use, and counseling also given to take medication on a proper time regularly. That is the adherence to medication. In counseling, you will also help the client address his personal, family, and social issues. So counseling is given to help the client stop using drugs or alcohol, build his skills, take medication on a regular basis or as suggested by the physician, plan treatment or recovery, address his issues such as personal issues, family issues, social issues. Family issues just mean issues between the spouses, issues among the parents and the children, brothers and sisters. There are so many issues, all financial issues, all these can come up. Sexual, financial, emotional, all these comes under these personal, family, social issues. Social issues can be occupational issues, legal issues. These are the areas or the needs that the client needs, need to be addressed. So counseling helps the client address these issues in a better, effective manner. Individual counseling sessions varies. It depends on the type of the program we are giving. In what stage of the client is in the recovery and client's needs. So we cannot just say this is the criteria for individual counseling. Individual counseling is tailored in accordance with the needs of the client. Where he is. If a client is in a pre-contemplative stage, the individual counseling may be different. He may not be able to even counseling because he is in the pre-contemplative stage. You know what are the stages of motivation. So whereas a person in preparation stage, the counseling is different because he is in the recovery, he has prepared himself, and in action stage is quite different because he is undergoing the treatment. So it's all depend on the stages of recovery and also the motivation and also his needs. A client who is having emotional issues may require much of the counseling to handle his emotions. Whereas a client who is having issues of spouses, means family adjustment issues, then he needs counseling to handle those issues. Another client may not be having any personal issues. He may be having an issue with his employer. So we must give counseling to handle that particular issue. It's not that we just plan individual counseling for all same, but we plan individual counseling according to the needs of individual. In other words, everything is individualized. That's why we said treatment plan is individualized. I'm just skipping these. All these we already discussed. And how do we end a session in counseling? We will be learning more about this in module 4 on day after tomorrow. We'll discuss further these things. Anyhow, when we end a counseling session, we must summarize. We must also schedule the next meeting. That means we must plan the next session. Group counseling. Group counseling is actually given to the clients. Basically, the 2 points to help the client improve his communication and socialization skills. And this group counseling is generally done as a structured therapy. That means it is actually gives the client an idea of how to lead a structured life, how to be disciplined. All these things will be the criteria where that which he learns in the process of group counseling. I think it is getting time. We need to, it's getting time because what's the time now in your country? Hello.
2:40.
Hello.
It is
Pardon?
4:40 p.m. in Myanmar and 5:10 p.m. in
Okay. Is it
Thailand.
time to wind up the session? Is
Right,
it to is it time to wind up the session, or do you want me to continue? I have no issue. If you are tired, we will wind up and then we will continue tomorrow.
I think it's time to wind up.
Yeah. Okay, Chief. We will wind up. Any question for the day, my dear friends? All respected friends.
No question. Thailand, no question.
Okay. I get it. I get it. I get it. I really understand you as a counselor. You all want to go home. Please. Please.
Traffic jam. My participant
Okay.
say Bangkok is tough.
Okay. Okay. Let's say goodbye for today. We shall meet tomorrow morning.
Bye bye.
Okay. Bye bye. Bye bye. Bye bye. Yeah. Okay. See you.
Would like to talk to you. Can you please rate the Thai thing? Ajahn Prabhupada would like to join for a few words. So can you please wait? I'm sorry.
Yeah.
And then please don't forget to take post-test at the end of the day, each day, and then take the pre-test for the upcoming days. So because I had some feedback that the participants didn't finish the yesterday's post-test. So please make sure to finish the post-test and the pre-test too.
Okay.
Okay, I can.
Very good. Very good. Very good, Panida. Very good suggestion.
Okay.
Okay. Very good.
Thank you very much.
Okay. Thank you. So thank you. Go ahead. Let's see next morning. Till then, goodbye and good night.
Yeah.
Sweet dreams. Sweet dreams. Yeah. Okay. Okay. Okay.
Thank you, Chisu. Chisu.
Thank you วันนี้เสร็จแล้วค่ะ
เขาให้เน้นให้ทำพรีเทสกับโปรเทสนะคะก็คือเดี๋ยวจบวันนี้เรากลับไปทำโปรเทสกันด้วย แล้วก็เตรียมทำพรีเทสของพรุ่งนี้ของ3อะค่ะเพื่อที่จะได้นี่
ก็มีการบ้านวันนี้น่าจะ
ไม่มีมั้งเพราะว่าไม่เห็นอาจารย์ประภาพันธ์พูดอะไร แต่ถ้ามีเดี๋ยวจะรีบส่งเข้าไปถ้าได้รับอีเมล
น่าจะการบ้านวันเป็นวันก็ได้นะเป็นคิว
เพิ่งกลับเรียนมาเพิ่งกลับเลยต้องส่งตรงไหนไหมวันที่เกี่ยวแล้วตรงนี้เราอ่านพูดใช้ไม่ได้แล้วค่ะไม่เถื่อนประเด็นขึ้นแล้วหรอ
ช่วงนี้ให้เลยว่าจะอยู่
Ajahn Tomchai, since all the participants left the room, could you please tell Ajahn Prabhupada that she can have some words tomorrow because I can't stop them. They are leaving very soon. So
Okay.
yes, please tell Ajahn Prabhupada.
Okay,
I cannot stop. Yes, they left.
Okay, I will leave. No. I will leave the message for Thai participant everyone for tomorrow. Maybe 8:30. We'll talk with Ajahn Prabhupada first.
Right. Or maybe you talk Ajahn Prabhupada.
Okay.
What's the plan? Okay.
Yeah,
Thank you, Ajahn
thank you,
Tomchai.
Sister.
Oh, Ajahn is coming. Ajahn. Ajahn, they left. Ajahn.
Hi.
Ajahn, they left. They already left.
Oh, really?
I told them, but they left.
Oh, already left. All right.
Yes.
Oh, because I have another class, so I
Yes.
am quickly leave and then join. So it is better. How many people are here, Dr. Dongchai?
You and me and my dad. Only 4.
Dr. Dongchai also, right? So
Yes.
Dr.
I'm
Dongchai,
joining the GITMM.
Dr.
I'm
Dongchai,
presenting on
please.
the GITMM.
Ah,
GITMM is at the TrustMed.
oh, great. So, but I saw Dr. Dongchai is not leave, right? Ajahn
Yes,
Dongchai,
she's still here.
Ajahn Dongchai, you hear me? Ajahn Dongchai, please.